Focus right there on Mom. Focus on Mom.
You can call him Agent P. You can call him Agent P. Agent P. Oh, wait.
All right.
Wins? Mom wins! Winners!
Okay.
I'm used to writing in cursive. Mom wins!
Listen up, guys.
Let's eat? Okay.
Have a seat.
Okay, Mom, look. Time to see. Mom. Mom versus cancer.
This is the tale of Mom versus cancer. So I was just going to tell you everything that my doctor told us yesterday. You guys want to know?
Yeah.
Some people would say, don't tell your kids, that will scare them.
Yes. Ooh. Yeah, scare me.
Are you ready to be scared?
Yeah, you scare
Bring
me.
it on, I say.
Are you guys tough?
Yeah. Yes.
Pretty much you should know what is going on because so you're not surprised if something bad happens and we're not surprised if something good happens, right?
Yeah.
Alright, so this is me right now.
Mom, can you die? Can you die?
Oh yeah,
Would you have more chance of dying?
no I do. Yeah.
Like
Because I've got some really bad
98?
spots. You guys are junior.
Mom, like
Or
98?
that camera.
Like, Mom, 98%?
Not 98%. I'll tell you the percent.
57? Well, once are treatments. I hope the treatments will lose it.
Maybe zoom in a little.
Treatments will lose it. If you do everything, you have 34.
If I do nothing, I have 0 chance. No, it is 0. Okay, so right now, remember I used to have a little mole right there 5 years ago, and they took it off and they said, oh, there's cancer
They
there.
took it off.
They took it off, so we can wipe that one out.
They took it off.
And then they went in my lymph nodes, and there were 3 lymph nodes that had cancer.
Hold on, you wait up.
Yeah, they took that out, erased that.
Woohoo!
So then I was good for like 3 years, right?
Yeah.
No, was it 3?
Mhm.
3.5 years. And then suddenly I had a little spot right there on the other side of the knee, and I didn't think it was anything because they said you're probably not coming back, it's been so long. Do you remember that? And they took it off. And then they did a scan, and I had another one right here in my leg.
Uh-oh.
So they did surgery and they took that one out.
That
So
was last year.
so far we've had it just right here, right?
Around that.
So they always said that's kind of scary because usually if it goes right there, it's going to go everywhere.
And it did.
So
Well,
they've
no, it's
been-
on your brain.
So they've been doing those scans every 3 months to see if and it's been clean for a whole year. And then this time it came back and they said, you know what, this looks way different than any of your other scans.
Uh-oh.
Because there's cancer now. They said you have a big one, you have like a hip bone right here.
Bro, that's a huge one.
I have
Oh, okay, that's not the tumor, right?
I have a big tumor right here.
Oh, that's large.
I have a femur bone right here.
Like
And almost exactly where Stephen has had cancer, I have a tumor right there.
How
I
come
have
the
a
new
little
ones are always
tumor
way
right
bigger?
here.
How
Huh?
come the new tumors are a lot bigger than the old ones?
Well, they are bigger. They're a lot bigger than the other ones.
Wait, so
She's not
then I
just
have to
telling
do
them
the
bigger.
same thing
Yeah,
as Steven to you?
No? Why do you think they won't do amputation to me?
Because the cancer cells are still going in your body, so that wouldn't really work.
Because
Unless you
watch, Luke, if
amputated,
they
like,
cut my
everything.
leg off, what do I still have?
Your femur bone? Your femur bone.
No, I still have cancer in places that they can't take it out.
That'd be funny. Like,
One of the bad ones is in my liver.
Ooh.
I've got 2 in my liver, and that's kind of one you need to live. And then I've got a ton up here in my chest. I don't know, a ton. I have a few there.
At least 3.
And they said possibly one by my stomach,
Darn.
but that's where they're seeing it right now. Wait, did I have any in my left? Just right
That
here.
one
right?
in the
Oh,
left
and
side.
I have another spot in my bone right here.
Oh, yikes.
So the bad parts are the bones and the liver. And part of that is because it hurts.
Hold on, Nucky.
Other parts.
Yeah, let's not do, we won't amputate. Do you see why we're not going to
Oh.
amputate Luke?
Is Luke erasing the amputation? Good.
Yeah.
Yeah, we're not
Do
amputating.
you see why we're not going to do that?
Yeah.
We can't take all of this out, and even if they did take it all out,
There'd still be some.
it's still in the blood, so it's going to pop back up somewhere else, for sure.
So that's why you need chemo to get it all out.
Yeah, so most cancers you would do chemo,
But
and it would
chemo's-
shrink it, or it might cure it.
Are you
Because-
doing chemo?
Do you know what chemo does?
No.
It kills all the fast-growing cells, and cancer is growing like super fast.
So that's
But it doesn't really work on melanoma. So here's what they can do for melanoma, and here's what we're going to try. There's a few things.
IL-2.
First, we're trying IL-2,
What's that?
interleukin-2. It's a drug, and do you remember last time when I got medicine? They put a line
Yeah.
through my arm
I
up to
don't
my
remember
heart.
this actually.
You don't remember? I had this IV line, kind of like Stephen had a port. Luke. It goes up here into my heart, right into my heart. So then I go into the hospital for a whole week.
Radiation.
Oh yeah. First of all, they're gonna do radiation. Because this hurts me, they're gonna radiate. They just burn. They have this machine that comes in and it burns that.
So like
And they're
gets
gonna
rid
burn
of it?
this one too.
It kind of breaks it down.
Yeah,
Kinda
it'll
So
try.
makes like a bunch of teeny ones.
Yeah.
Yeah, they do
That's
it for a
good,
lot of
right?
cancers. Well, yeah, but it's not helping with the cancer. It's mostly they think it's gonna help me with the pain, and then also
And the chemo will be more effective.
the chemo might be more effective because they're killing the cancer cells, and maybe the body will come and try to, since it's dead tissue, it'll come and try to
Clean it up.
clean it up and boost the immune system. So they're gonna do this next week, radiation. Then the next week is when I go to the hospital, IL-2. So I get in the hospital bed. They start giving me these bags of medicine. Do you remember how Stephen had those bags of medicine? I just have kind of one bag called IL-2.
One bag does a
No, they do a bag every 5 hours.
well,
They just
one
keep
bag
giving it
of
to me
food
until I
stuff.
can't stand it anymore. Up to
Oh.
like 14 bags or something.
That's great.
And I'll just like diarrhea, throw up, I'll be tired, I might not remember anything. I'm gonna like
Like
get
do you
fluid
think anything?
everywhere. I might not remember the week very well.
Okay.
Can you turn off the
Not like complete amnesia. Complete death.
No, if you come visit me, I'll probably know who you are.
There's a stranger. Oh no.
I'll probably get to talk to you, like we can FaceTime every day and stuff.
Oh yeah, FaceTime.
You guys can be like, how you doing? And I'll be like, I'm so sick.
Yeah, because the Coons have an iPad.
We have two.
Yeah, we have two. I can take one. You guys can have one.
Okay. And the Coons have one, so they can FaceTime.
So Dad will have to be with me too, because I have to have someone there helping me the whole time because I'm going to be so miserable.
I know.
He said chemo's like on difficulty level 1 to 10. He said this one is close to 10.
Like 9.
It's really hard. Really hard on your body.
What's
But it's only 5 days.
We call IL-2.
we'll
we
call
might
this
say
chemo.
IL-2. We'll call it chemo, but it's different than a normal chemo.
So I'm in the hospital for 5 to 7
5 to 6
days.
days.
And then I get to come home for a week. And then I go back to the hospital and do the same thing.
The second time's gonna be a lot.
And then I'm
worse.
home for
2 weeks.
Like a month.
a month. And then we rescan.
Ginger, come.
Nice one.
Ginger, come here.
That's funny.
Come
I'm
here.
like, I don't think that is relevant.
Definitely.
Is that recording? That's funny. Okay. So, yes. It will be sad. You guys will have to be good when you're at home.
My marker's blue.
No.
Mine's
No.
blue.
It did.
I need my eye.
Oh, that
I'll
was
take my eye out. Give me my eye.
Oh, it's placed a little bit wrong.
They, no.
James, leave him alone.
I was gonna make him.
No, let him do his thing.
Guys, don't laugh at this, Mia.
Oh, it's got
Guys!
Okay, did you put her eye back?
Okay.
Thanks, Luke. That's more like it. That's what's going to be happening. So I'll be hooked up to like all the monitors. Steven had a lot of bags, I'll have a lot of monitors. They have to watch my blood pressure the whole time and my heart so it doesn't make any weird jumps.
Like,
But any of that
Fix.
stuff, they can usually fix. And they'll watch and see. And if anything's going really bad, they'll pull me off the medicine.
oh, why would they pull you off medicine?
Luke, sit down now. What are you doing?
How do you spell lamb? W.
A8.
A.
Okay, now sit down, Luke, and let mom finish. Okay, buddy?
Wow.
Luke, sit down.
I just marked you up.
Luke,
Okay.
please. Thank you.
So then I'll be home for a month. During that month,
You will be sick. And
we're going
She
to
won't be sick.
Maryland. I won't be very sick.
When she's not at the hospital, she
Unless-
won't be very sick at all.
Unless the
Wait,
cancer's getting worse. Yeah, we're gonna go to Maryland, because guess what's in Maryland?
the best cure so far ever to exist.
Some are saying. That's what we're hoping, right? But they have this trial where they take a tumor out, and this is what we're gonna go to Maryland for. They're just gonna do a surgery, take a couple of these tumors out, put them in a test tube or petri dish, I don't know what they do. They take the T cells out. The T cells are what kills the cancer. They're gonna take those specific T cells and then they're gonna grow them. They're gonna see how many they can grow.
Billions, hopefully.
Tons of T cells. They're gonna start growing them, and this takes a few months to grow. So,
And then they put it back in and it kills everything. Yes.
yep, if we decide to do that. So then we'll fly to Maryland, do that. Maybe we'll have some fun. We'll go see Trev.
Yeah, we're gonna
That's
stay
where
with
they
them
live.
maybe. And
Wait, and how much? A week or two?
yeah.
Oh, how long are we gonna stay? Probably a week-ish.
No, like how much? How
That
much?
would be in
March. Luke, 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 James,
Stop it.
take them apart then.
You need to listen.
Yeah.
Okay. So, this is going to be one of an option. So then we'll have these cells growing. About 50% of the people, they'll be able to get cells from. 50% they're not able to, but we're going to assume that will work. So then we come back and we do a scan, and they look at my body again, and they're going to say, okay, did these get bigger? Did they get smaller?
Let's say that
Are
one.
there any more?
Are there extra ones, or are there any more?
No,
or are we
let's say all of them are gone. Yeah.
That would be awesome. Do you know what that would mean?
What?
I'm probably going to be cured from this one drug.
That'd be sweet. And then you never
Well,
be
cured means it will never come back.
So you weren't cured.
What do you
last
think the
time?
percent chance is of that?
4.
6%. About 6% chance
The IL-2 will work.
that IL-2 will cure me,
20% that T cells will work.
possibly.
Right? Isn't
Maybe
that
not that high.
Assuming we have time to get to all of these things. But we're starting here. This one's pretty fast. 6% chance, but probably on the first scans, they might, if it's working, they might just look smaller or stay. They probably won't be all gone yet. So I might have to do that 2
If
more
the first
times.
one totally works and you get cured
That would be
and
cool.
never come back.
Rock. That would be the best case scenario,
Is that
right?
6%?
That would be in the 6%.
6%.
Actually, best case scenario is somehow your T cells multiply and attack your cancer. So when you get scanned before IL-2.
No,
Isn't
they're
that
just
in there?
this is gonna stay in Maryland.
I know, I'm just
I
saying.
can't do this
No,
one
no,
yet.
like before you even start IL-2.
Oh, that'd be cool.
Somehow your T cells multiply and do it before you move.
That'd be cool.
That'd be sweet.
Because I have so much, that's probably not gonna happen.
Yeah, I know, I'm just saying. Isn't that like
That would be
1%
cool.
chance?
Yeah, maybe there's a 1% chance of that. I don't know. Okay, so let's pretend we come back and we see some more extra.
No.
Extra,
So after the
or-
first scan.
Or these get bigger.
No.
Then guess what? We're moving to Plan B. Plan B is not a bad plan.
Ippy.
Ipi. Ipi is a drug that came out this
Last
year.
Ipilimumab.
Ipilimumab.
Ipilimumab. I don't even know how to say the whole thing. Ipi, I go in to the hospital once
Like one day.
a week or a
Maybe
month.
It's like
Once a month, I just go in or something. I don't know the protocol yet. Go in, they just start an IV and they give me the medicine. I come home. I don't really feel that sick. I might have diarrhea. And then they do that for 4 months. And then they scan you again and see if it worked. If it works, that's really good news.
And you're gonna make medical history.
And I'm gonna go to-
10%? Ippy?
Ipi has about a 10% cure.
Woohoo! Go
Okay.
Ippy.
Go Ippy,
I
right?
hope you guys accidentally change your mind and accidentally say Ippy for a